gente!
Sobre, Mesa, a podcast from our table to yours. Today's episode is about mental health.
Yes.
And we have a very special guest at our Mesa here today, the lovely Jennifer Miranda, who has been my bestie friend since we were 14.
Yeah, like 14 years old, yeah.
Yeah, we met freshman year of high school. We've been pretty much inseparable since. And today, she is our resident expert on mental health, as she just graduated with her master's. So please, tell us about yourself.
Hello. It's nice to be here. Thank you for everybody having me here today. But yeah, no, I was born and raised in Puerto Rico, and I started off first moving to Arizona, and then ended up in Florida, and now I'm here in Chicago with these lovely, lovely people.
Yes. She is in no relation to Lin-Manuel.
No
I know.
relation.
However-
But they are both Puerto Rican.
However, we did see Lynn in
Yeah, we
Hamilton,
did.
Puerto Rico.
In Hamilton, Puerto Rico. We were there in the flesh,
In
watching
fact.
Lin-Manuel Miranda.
On
at
closing
Hamilton.
weekend, in fact.
Closing weekend. Quite a memory.
Yeah.
Absolutely.
Epic.
And Jen is a big friend to all of us now.
Yes.
Big friend to the Mila Tinidad family. She's been to the live show that we did back in 2019. And we just wanted to talk a little bit about mental health today. It's obviously very important, and in the Latinx community, it's a very taboo subject to this day. And we probably need it not more than any more community, but we need it just as much.
Yeah.
And I think that it's really important the more that we highlight these stories to make it be a part of our company as well.
Absolutely.
Period.
Yeah.
Okay, Miss Jennifer, you're in the hot seat.
I'm in the hot seat.
Yeah.
Hit me.
All right, what's the first question?
Okay, so tell us a little bit about what got you started into mental health, especially like coming in as an immigrant. When did you decide that you wanted to major in this? How did you come about it?
Yeah, so it kind of all started, I feel like it's something that came to me rather than like me looking for it.
Mm-hmm.
When I was in high school, I just kept getting told by people like, oh my gosh, you just have this presence, and like I feel like I can trust you with all these things. I'm like, all right, that's weird. It's like, cool. But it just like kept happening and happening with like different people that I didn't even know, and like strangers. So I'm like, all right, cool. And I took this AP psychology class, and I just became obsessed with it. It was like that one class that like I didn't have to study for, and I'm not that person. Like I have to study to get good grades, and it was like freaky. And I was like, all right, I really like this. So I went to college, and I decided to major in psychology, but like I kind of just liked everything that had to do with psychology. I never really put together like people being like, hey, you should be a therapist. I'm like, oh, shut up. Like, you just being nice. Until I started learning a little bit more about like anxiety and depression and like all these things that are like across cultures. I'm like, that's actually sounds a little bit important. And it sounds like it's something that affects every single human being that there is. And I kind of just fell in love with it there. It was especially important because I didn't grow up learning about these things. It was kind of like till I got to college, I was like, oh, this is what anxiety looks like. This is what depression looks like, and everything in between. It was never a conversation I ever had like growing up whatsoever. So it kind of just opened like this whole can of worms, and like, okay, let's actually put these two things together and take it from there. Yeah. And here I am.
Absolutely. I know when I first met Jennifer, she was very passionate about wanting to deliver babies, be an obstetrician. And that was your track for a while. She was very focused on going to med school and being an obstetrician. But when you fell in love with psychology, I remember so distinctly, like, hearing you say that you still wanted to work with mothers and children, but in this lens of psychology, and she actually specializes in postpartum care.
Yeah.
So that's really cool, especially for somebody like you who there are very few Latinx therapists, mental health providers, Latina therapists, mental health providers, especially, I'm sure, in that specific specialty.
Yeah.
So you're definitely bridging a gap. You're definitely filling a need. And I'm so proud of you.
Yeah.
Thank you.
I think it's really important too, like you said, like not growing up hearing all of this stuff, because I remember growing up, I feel like especially in like the immigrant sector where it's like we don't have time to think about that. We have to think about so many other things. We have to like there's no time for being sad. There's no time for taking time to take care of yourself. And I see the clock or like the gears turning recently with this new generation, and I'm like so happy to see it, you know.
Yeah, so many people our age and like a couple ages above us are really making a point to being like, I'm gonna break like the trauma cycle. Like I see what's going on with you, and I know what's going on with me, and like I can dissect things that are happening within the community, and I want to like do something about it, and just instead of just kind of like accepting like this is what it is. It doesn't have to be that, you know, like we can all grow and heal.
Yeah. Absolutely. And that brings me back to like when I started therapy when I was a child. Like it was this thing we didn't talk about it like in our communities, but when I did move to the States, like my parents were like, okay, this is kind of like a hard thing. Let's try to see if we can talk to somebody. And a lot of the times in moving to the States, there's a lot of challenges. And, you know, in our communities, they say, get over it. Like, it's just, you know, like, it's just life. You just have to do what you have to do. And mind you, I was like 13, 14 years old. Puberty, all these
rough
medical
times. Rough times.
Yeah, that could be a whole episode in itself.
Puberty.
I won't get into
There's
it.
probably podcasts on puberty.
I'm sure there are.
God, but it was just really hard. And I remember when I first sat down, I was like, this is weird. I was like, who are you to say anything about me? And like, only the crazy, like los locos, like go to therapy. So I was like, oh, I must be really messed up now if my parents think this is the place I have to be. And it was weird because I sat down, I talked about how I was feeling, and she was the first person to like validate what I was going through. She was like, what you're going through sucks. Like, you just moved to a whole new country. Like, yeah, it's a U.S. territory, Puerto Rico, but like it's a whole different thing.
Oh my god, the culture shock,
especially in Arizona.
Yeah, in Arizona, which is completely different than like my experience in Florida and all that stuff. But she validated those feelings, and I was like, oh my gosh, that is so weird. Like, what? I'm not crazy. I'm not crazy for feeling how I do. So yeah, you bring a great point with that.
Yeah,
absolutely.
Was your therapist white or a person of color?
That one, she was white, which actually added on to it. I was sitting down, I was like, who the heck is this?
Yeah.
Like, you know nothing about what I'm going through, like all this stuff. Which really, really adds to a point that I want to emphasize, that a lot of the times we will think like, oh, I can only go to a therapist that's of the same race and like all this stuff. And actually that experience really taught me, it's like, okay, like maybe I can expand a little bit more. Mind you, every therapist is different. Everybody has different training. But she was pretty amazing, and she did help me through a lot. And as an adult, I also saw another white therapist, which was an amazing experience too.
That's
great. Yeah, and also I guess it depends on like what you need and what you're looking for in a therapist, and what it is that you feel like you want to work on in yourself. Especially like now, like I'm like older, and now I'm looking for therapy, and I'm like, I want a Latina therapist, but maybe it doesn't have to be a Latina therapist. It could just be a brown therapist. But that's also because the community I'm in right now, I feel very validated in my experience. It's not something that I'm necessarily seeking in. I'm seeking in other internal factors. So, but it just depends on what part of your growth you're in. I like heard once that like therapy is like dating, like you can just like try a couple people out, you know, until you find like the right person, and that's like okay. Because I was always so afraid that I was like, oh my god, if I don't like this therapist, then either I'm not cut out for therapy, or this therapist is horrible, and then everything is horrible, you know.
And then just why not?
But that's not necessarily true. Like they could work for somebody else.
I think it's very interesting because there are like so few therapists of color, or like people in the mental health field that are people of color, because it's just like it's such a rigorous process. You can speak to that, but your grad program,
and I'm sure that in those higher levels too, that it can be very elitist.
And so like I grew up in like a predominantly white town, and so growing up I had like white therapists, and it never even crossed my mind that like I could have like a Latinx therapist. I was just like, that's not an option. Like everywhere I'm seeing all these lists, they don't have them. And I didn't realize that was like affecting like my healing process until I did get a Latina therapist. And then I was like, oh, I don't have to like explain my culture to you. I don't have to explain this like othering that's been done to me. You're not like questioning things because you're like, you don't like agree with it, but because you just simply don't understand it. And so that was something that I thought was like really interesting. But it's not like those white therapists like didn't help me in ways that they knew how to, but it's just like sometimes it really is there's no blanket statements that can be made. It's like person to person basis. Like it's just some people work well with certain people, some people have specialties like you, and some people like are really based on like community, or really based on like gender or sexuality and stuff. And so I always thought it was like a really interesting thing because I didn't even like clock that was a thing, and I've been in therapy for years.
You know, I'm kind of low-key in a weird way because the first time I ever went to therapy was actually family therapy when my family was going through a really hard time before my parents divorced. And throughout that time, there were like individual sessions that we had with our therapist, and then there were like group sessions with the whole family. And then even when we had moved to Florida, I would have checkups with him on the phone. And he was a bilingual man, a Dominican man, who I knew had sessions with my mother, my father, my brother. Like there were
he knew the tea.
he knew the ins and outs of absolutely everything. So now that I'm an adult and trying to seek out therapy for myself, I work at a Starbucks, and Starbucks does this like Lyra program. There's a mental health program where you can talk to somebody, you get X amount of sessions for X amount of time.
That's awesome.
And you can talk to someone over the phone, which is great. And I've tried that out, but it does feel so weird in the sense that am I about to really open up about what's on my heart to this perfect stranger that I can't even look at?
Someone I haven't built rapport
Exactly.
with.
In the sense that the first time I saw my childhood therapist, Ramiro, I was like 6 or 7.
Right.
So like
you were more trusting.
Exactly. I was super trusting, and like the Spanglish was a thing. Like it's one of those things that like when I was telling him a story, I could very easily jump from language to language, and the through line was followed, and it was never something I had to worry about was communicating myself properly to Ramiro, helping him understand my family dynamics. I knew he got it. Like all of these things that I'm afraid to start at ground zero with someone else. And I do recognize that.
I have a couple of thoughts on that and a question, because I similar to what Jen was saying, I've had positive experiences with white therapists. I've had positive experiences with therapists of color. But I also think back to the time in my life when I had those white therapists, and I was already in a point in my life where I was ready to talk about mental health. I had already made progress with my family on talking about mental health, because I also grew up with the whole, terapias para los locos. Like, everybody has that story. Everyone's heard that before. And I know it's difficult for the older generation of Latin Americans to talk about it because they were raised that way. And, it's hard for them to see their kids suffering, and they think to themselves, like, I give you everything, like, how can you be sad, and you have to explain to them, it's chemical. I'm sorry. It's not that I'm ungrateful, But I'm wondering if I hadn't been in that point of my life where I was comfortable talking about it with my family. I'm thinking about kids who have older generation Latin American parents who have a hard time talking and addressing these mental health issues. As a therapist, how do you help, as a white therapist especially, if you don't understand that, how do you help these kids deal with that, talking to their parents about it, when the kid keeps saying, like, they don't want to hear it, they don't understand, So, and I'm not saying it's not possible, because there are plenty of white therapists out there that are familiar with that part of the culture and can deal with that in that way. But I'm wondering, Jen, like for you, if a kid comes to you and says, like, I definitely have this mental health issue, and my parents just like won't even acknowledge that it's real, or, they keep telling me I just have an attitude, or, it's like, what do you say to them? Like, how do you go through that with them and explain to them the best way to open that line of discussion with parents that are just a little bit, stubborn about it?
Absolutely.
Yeah.
Well, I was that kid once, where I told my parents, I was saying, like, I'm going through a lot right now, like, especially with this move. And that's like where I go back to that moment where that one therapist, who was white, validated those feelings. It was like, you know what, like, this is a lot that you're going through, and how do we communicate that with your parents? In those moments, it was more about, you have to meet the client where they're at, how they're feeling, what are they going through, and validate what they're going through, because this is the relationship between you and them, not necessarily the parents themselves. And they also know their parents the best. Unfortunately, we can't control other people as much as we wish we could. And there was this magic pill that we can control, like, yes, these parents are going to be perfectly accepting. But the primary goal in that is to make sure that that person, that client, that kid has somebody they can talk to, somebody they can go through for these moments, and take it step by step by them. Unfortunately, it's not like a cookie cutter situation in which, like, okay, this is what you do, and like the parents will understand, and this is what's gonna happen.
This PowerPoint, show them this.
Here it is, like all this stuff that they're going through, and you're gonna understand perfectly right now. No family's different or the same. Sorry, no family's the same. They all have their own story. They all have their own unique quirks and characteristics. So it's just making sure my priority would be just focusing on the person that's in front of you, and then just validating those moments there, and then taking it from there. I'm sorry, there's no cookie cutter answer to that.
Yeah.
We all wish, don't we? No, I mean, you're right. Focusing on the individual is definitely the most important part. And, maybe they're not getting that validation from their parent, but that's why they're there to begin with, So that makes sense to me. Thanks.
I mean, that kind of makes sense too when you start working on yourself, and this also comes with like the growth of getting older and getting to know who you are. But in general, when you start working on yourself, especially with a therapist, then you know your intentions and you know your heart. And since you're the person that knows the people you have relationships with, whether it be your parents, friends, significant other, whatever, since you know those people best, then you can be like, well, you know what? This is what I'm going to say to you. This is valid to me because this is what I'm going through, and this is my life and my truth.
Yeah.
And you will know that the limits of how you can deal with it. Of like, maybe you'll never understand, but this is the best way that I can show you how to understand, knowing what I know about you and knowing what I need from you. And that's the only thing we can do. And I've come to see that the older I get and I start having conversations like that with my parents, where I'm like, listen, this isn't me acting crazy because I'm not 14 and 15 anymore. So maybe like the hormones were whack then. Maybe the hormones are whack now, but I'm an adult, so I can choose to say whether they're whack or not. And I don't think they are. And this is how I feel. And either
it's
that's that.
It's protecting your energy.
Protect your energy. If 2020 taught us anything, it was that.
Your energy.
Protect your energy.
Protect your spirit. Absolutely.
You have to. My therapist and I were working through like how to communicate with your family about like things that you're going through, and like them probably not responding in like the way that you want them to, and like how to cope with that situation. And like what we really figured out is I'm a very emotional person, and so like whenever I feel the feelings, I feel them real big. And so like in times of like not confrontation but like communicating vulnerability and stuff, I tend to like let my emotions overtake me. And we worked on like, you have to figure out how to, for me at least, how to like be vulnerable without letting the emotions overtake you, because of the way people have reacted in the past. They see the emotions and then they put that label of like, you're overreacting, you're just being crazy, you're blowing it out of proportion. So for me, it was like, okay, find a way to be vulnerable, but be like factual. And be like, this is what the situation is. This is how you make me feel by you doing X, Y, and Z, and just be very like calm about it. And so like if that means writing notes on your phone and like coming with like a script that you're gonna prepare, but still being open with them, because we talked about like you being open with people makes them want to be open with you too. Like people can only meet you where they're at, unfortunately, but like if you're showing them that you're willing to like be vulnerable with them, then a lot of the times people are willing to be vulnerable with you too, especially if you're talking about something that is difficult for you. And so that was something that really helped me.
That was so important for me to hear today.
Type
thing.
You're welcome, girl.
I know that I'm la llorona de my family. Like hands down pat. I'm incapable of speaking about anything that matters to me emotionally, physically, mentally, anything at all without crying. Like that's just my reality. If I care, I cry. Punto, se acabó. But like I am in my early 20s. I have been here quite a while now, and to this day, if I'm talking to my father about something that is like heavy on my heart or whatever, and I just start sobbing, to this day he's like, well, why are you crying? As if he doesn't know me, as if he doesn't know that this is what I do, that this is how I but it's so crazy because I've literally always been this way, and
it's not like it's going anywhere.
It's natural, but it's important to take a step back and really walk through maybe some of the points that I'm trying to make beforehand, so that the flood of emotions doesn't literally drown.
Create a little PowerPoint in your
head. Go through my points.
And it's
planning helps for sure. Like it really does.
And like the reason like we had to do that together is because like I wasn't able to like execute my points because I was like crying so much, and I was like, and I would let them interrupt me, and I would be like, okay, I need to have a conversation with you about this, and I need you to just let me finish it. Even if I'm like struggling through it, I need you to like not make comments about me crying. Like if I do, I apologize.
You shouldn't.
I shouldn't have to, but like your father. My father's also very like, he's like, stop crying.
He's like, well, it's not that big of a deal.
Yeah.
You can tell me you don't have to cry.
Yes,
Like, just tell me you don't cry. And I'm like, but this is how I feel.
Yeah,
That's
it's not
because
even like
it's Latino men don't like to cry.
Yeah.
So
my dad is not like, oh my god, you're like crying. It's just like he's just like, can we do this without it? Like, I know that you can do it without it. And I was like, I don't know if I can. I don't know
I'm like, let me just get it out. How many times have you seen your dad cry in your life?
Oh, I think
For me, it's like twice.
I feel like
and he shook me both times.
Good question.
I feel like maybe like 5-6 times.
Okay,
yeah.
okay.
Yeah.
I can
Wasn't that
picture
long
the
ago.
2 times I've seen my dad cry, and
Wild.
it still shakes me to think
Yeah.
about.
But like the reason that we did that was because it was like I needed to get my point across so much. Like it was so frustrating to me
Mhm.
that people weren't hearing what I was saying. They were
Mhm.
just like taking what I was emotionally giving to them
Mhm.
and then not hearing the actual words of like, I need you to do this
Of
for our
course.
relationship.
Mhm.
Like this is what I need for like me to feel safe around you, for me to feel like I can like open up to you, for me to want to like reach out to you, etc.
Yeah.
And so like if that's not going to happen, then I don't know what to do.
Mhm.
And so it's just this feeling of like stuckness, and like I didn't want to be in that stuck place anymore. I was like, I want to find a solution.
Yeah.
So like I needed to figure out, okay, how is this person going to best respond to hearing that information? And like for some people it was like I couldn't be emotional, but like other people in my life, that's not a problem.
Yeah.
So I think it is like figuring out your audience, and then
Know
your
your
audience,
audience.
know your audience, and then like cater to them, you know.
Yeah.
And I think it's just like you have to do that.
But you
because-
find that all out in therapy.
in in
Yeah,
therapy. Yeah,
exactly.
like I would have never known that before that.
Yeah.
Yeah,
I
things work differently for everybody. But yeah, go ahead.
Oh, I have a question for you,
Yes.
Jen.
I might have an answer.
So I know that I've told you this before, and you didn't know, and so then we tried to look it up. That trigger warning, but Latinas have one of the highest suicide rates in the United States. Latina women, which makes sense if you come from immigrant parents who have all of this expectation on you. And I think like on social media, especially, and in the media, we see this like whole girl boss, but like turned into a Latina wave where they're like, you can do it, girl. You can be the first to graduate. You can be the this and the that and the that and the this. And that's a lot of pressure to put on someone, you know?
Absolutely.
So I wanted to ask you, what are some of the main things that you see working, or well, that you've experienced as you being a Latina in grad school, but also like that you see in working with moms that are like Latinx or Black or Brown, as opposed to white women or white people, that you see like the difference in what are the main things that you talk about in these sessions?
Good question. So many things. Wow. But what stands out to me the most, I want to say in the vast majority of all the Latinx moms that I work with, we always have the conversation about what does it mean to be in therapy? Like, what does that mean? What does it mean if we're taking medication? That's especially if we're like pregnant or postpartum, as like there's this huge stigma just with going to therapy in the first place. 2, taking medication. 3, if this is all happening during pregnancy or postpartum, it's like, oh my gosh, there's something wrong with me, especially because we often have this message of like, oh, as a mom or like as a woman in a Latino household, like I'm supposed to have it together. I'm supposed to know how to do all these things and like know how to take care of a baby and clean the house and cook and like all
people
this
just
stuff.
think that pregnancy and early motherhood should be the happiest time of your life.
Yeah,
period.
and it's not
That's
for
just
everyone.
assumed, and it's difficult. There's so many
Absolutely.
difficulties that come with it.
A lot of
Yeah.
changes very quickly.
We have this image that like once the baby's like placed on our chest, it's like, oh, magical moment,
Everything's
rainbows
new.
and butterflies, and like I just know this little tiny human all of a sudden. And that's just not how it is for a lot of people. It's actually more of a rare situation if it's an instinct connection that you have there. But things that I've noticed is a lot of the times it's just having those conversations and like normalizing what it's like to be in therapy. And huge kudos for taking that step to go to therapy, especially with the messages we get in society and like our parents and like our culture. Like just a huge step in itself, because a lot of the times when I work with Latina women, it's like this is the first time that they're talking to somebody. It's like, oh my gosh, because I don't want to tell my family doesn't know I'm going to therapy, my husband doesn't know I'm taking medication, all these things. So kind of talking about that, that's something I've noticed much more in the Latinx community. Mind you, I do see that in like other cultures as well, but it's much more prominent from my own experience with Latina women. In grad school, being in grad school as a Latina woman, that was an interesting experience. I want to say that's probably the moments in my life where I really started to notice more like I am the only person here that's not white.
Yeah.
Like, and that happened over and over and over again, and it was such an interesting experience, is the least that I can say. One of the most significant moments was in my very first class. It was multicultural counseling. My professor, she goes, okay, all of the white people, I need you guys to sit in the front of the room and talk about white privilege. I'm like, what?
Oh.
Yeah, so they all had a conversation about white privilege and all this stuff. And it's like, all right, go sit down. Now all the non-white people, go ahead and sit down and talk about white privilege. And it was like 4 of us.
Yeah.
In that circle. Well, like with the white people, it was like 15.
Yeah.
So it was quite an experience, and I was like, well, this is what grad school is gonna be like.
That is so interesting. What was like the difference in those conversations?
It was, I remember for the people of color, it was a lot of the talking about the hurt and like all of the experiences we've had, while a lot of the white people, it was more about the guilt and like not knowing of like what it is, which are completely valid points from both experiences. But that really opened my eyes of like, oh, this is what it's like to be a non-white person in grad school, especially for counseling, because
and it's insane that you say that too, because you know, as much as you are Latina women and a woman of color in your own right, for you to be the only woman of color and you have a very close proximity to whiteness is very alarming. And I really hope we see a change in that. So keep fighting, even though they're trying to keep us down.
No, we definitely need to keep fighting.
Yeah, kudos to that professor. I loved her. She was amazing. She was a professor of color, and she learned how to manage everything so well, because it's a hard class to teach.
That's
of course,
and that's really important too. That like the class itself was taught by a person of color as well.
Yeah,
it must be hard to be a person of color teaching about multicultural things to a room of white.
Oh yeah, a lot of people turn down that position. Like she was, she talked about it.
I mean, that's like, reliving trauma all the time.
Oh yeah, that was. It could be a whole other episode of that whole class, and a lot of stuff happened that class. But she was amazing. She managed everything with grace, and I don't think anybody else could have done such a great job.
Absolutely,
that's beautiful to hear. Honestly,
What were you gonna say, Tati?
I have a question about barriers. So I consider myself a success story because, you know, me and my family were able to work our way to being open about talking about mental health, which was a big difference from like when I was really young. So that's awesome. And I celebrate that. But I also acknowledge that I have a lot of privilege. So when me and my family were ready to talk about it, therapy was accessible to me because I had things like healthcare and I didn't have to worry about a roof over my head and food on the table, you know? So I want to talk a little bit about the barriers, and I'm wondering if maybe, Jen, you have some insight on this, or anyone else, you know, is free to answer as well, on accessibility for Latin American youth specifically, right? Like, because a lot of them, if they don't have private healthcare or they don't have access to healthcare at all, which is actually pretty common, unfortunately, you know, how, like, are there resources for them? And also when there are language barriers, you know, like getting them with the right therapist for that, and the little like idiosyncrasies that we wouldn't think of, like someone that, you know, we talked about this like another time, like I was saying, you know, when someone, a Spanish speaking person says like tengo nervios, to like someone who doesn't understand what that means might just be like, oh, that's something else, that's not depression. But they could very well be trying to say that they have like some sort of symptom, but there's just like a cultural difference there, you know. And then there's like the fear of separation for undocumented folks, you know, and even though there are like some confidential like resources for them, like just the fear of it at all, like I cannot send my kid there, you know, because what if they get separated from me and they get sent back, or I get sent back, you know? So it's just this, you know, it's difficult. And I guess what I'm trying to ask is, have you seen an improvement in those resources for these people that have low accessibility? And, you know, over the years, have you seen that as of late? I know that definitely the younger generation is fighting for these things, and I'm so proud of them for that. But yeah, just, do you have any insight on that or the improvements that have been happening over the past few years?
Yeah, I actually think that's one of the most frustrating areas because I run into a lot of people that want to like get mental health like counseling and everything, and there's limited resources out there. Thankfully, like they're just very hard to like bring out as like, hey, we offer free counseling,
Yeah.
for low cost. Insurance, and I think every therapist, doctor, anybody that is in any field that works with insurance will say insurance is a pain in the ass. They're horrible.
Yeah.
They are horrible. They're
The
huge.
clients do too. I think
Yeah.
insurance is a pain in the ass.
Yes,
Me, an
absolutely.
insurance holder.
Yes.
Yeah, the amount of times I wanted a therapist, like a certain therapist, but it wasn't covered, and so I had to switch a therapist I love for one that I didn't like that much. Like, oh, horrible.
There's so many unnecessary barriers to it. There's no point. Like, I will get into a rant with insurance.
Yes, in the Mesa.
Oh my gosh, a lot of them will have to like approve if you're gonna go see this therapist, or like how many sessions do you get. It's like they're not professionals. Like they're not the ones determining that, but they do determine that. It's like it's frustrating. Which adds on to us like, okay, like it's adding limitations that are unnecessary. We don't need it. We might have insurance, but my insurance doesn't want to cover it. They don't think I'm symptomatic enough to do these things. It's not even me. I know. I know.
You're not sick enough.
You're not sick enough to go.
That's
go.
disgusting. So
So
we're
you're gonna
till
wait
we
for me to get
you're gonna wait for me to
There's
feel terrible.
some insurance companies or some plans that will only cover if there's like suicidal ideation. When there's homicidal ideation, it's like, okay, so we're waiting.
Yeah.
For
And
this
so we're
person to get
dangerously in danger.
When we
In
could have very
danger.
easily prevented this at an earlier
Yeah.
stage.
And you make a great point, because one of the things that I like to emphasize about mental health is that it can be a preventative thing. You don't need to be going through something. You don't need to be having panic attacks to go and decide to go to therapy. We can go there from the beginning to try, like, when these things do come up, when I am having a panic attack, maybe now I have the tools to know what to do when that happens. Which is a little point there. A little point. But
Yeah. Really
A great point there.
I agree with that, because when we and Jen first became friends, I was kind of like, oh, therapy is great. I've never needed it. I'm a happy person. I love myself. And then she was like, oh, you think you will need it because one day you're not going to feel this way. And then one day I was like, oh my God. And she was like, well, and I was like, yeah, you're right.
What'd I say?
She told you.
Yeah, she did. But I think that's also a great way to reframe it. But back to your point.
It's just a way where, like, I picture like this little toolbox that we have, maybe a little shoebox or whatever, and then we go to therapy and we just add little things to it, and like different moments, different situations, we'll grab the tool that like helps us in that moment. Maybe the other ones are not effective in this moment, but like perhaps in the future they will, and like we'll be prepared for that. But going back to your question about limitations, it's pain in the ass. There are a lot of resources out there, but you really, really have to work for it, which is really unfortunate and really frustrating. And especially that fear of undocumented folks. That's something I run into so many times. I will say, like, as a therapist, if somebody is undocumented and they're there, we don't say anything. That's not our business to share. No, we're here for you and whoever you are, documented, undocumented, whoever it is. So that's a safe space, like, to talk about any of those things. But yeah, a lot of the times we just have to go look for resource centers, and they will be able to provide some things, or talk to your insurance and see what they provide. If you don't have insurance, again, going back to those resource centers, which I can provide. I know some in Illinois.
Awesome.
But
Put them in the bio.
Yeah, absolutely. We'll put them there,
Yes,
but it's a harder thing than it should be.
Yeah,
absolutely. And when this episode airs on our socials, on our Instagram, we will provide a little list of the places we talk about, and also places that we have found that are both safe for people with insurance and people without, because I think it's really important to include that. People don't really know where to go, and now in the media there's such like a, this is what you do for here, this is what you do for there. There's such an influx of information that it kind of feels like I don't know anything because I've been given everything.
Well, going off of that, so I built the website.
That she
Wow.
did.
A flex. No, I thought it was really important. The fact that like we're such a community-oriented company, I was really pushing for the fact that we have a community resources page on our website, so that people can they don't have to look for these things. Like, they know that like this is a place where you can find assistance, whatever it may be. And so in that, in the creation of that, I did a lot of digging, and I found some really cool resources. And one of them is it's this website called Therapy for Latinx. And it's basically a directory of therapists and mental health advocates who are Latinx that you can like go through their profiles, see what insurance gets covered by them, their location, do they do virtual, not virtual, like, and it really goes in depth. And like their whole thing was basically this of like, there isn't access to this to just the general public. Like you have to dig for this information. So instead of you doing that, let me take out the middleman for you. Here it is. You don't need to like search for help. Like we are here to help.
That's amazing.
So be sure to check out our community resources page on the website.
Yeah. Yes. So anything, Jen, you have for me, I'd be happy to post it up.
I have a few resources in mind, so we can add them there.
When this episode airs, if you love the lovely Jennifer Miranda, she will be available to be your therapist. She obviously centralizes on prenatal and postpartum. But in general, if you want to look at the resources, she's going to be working at Bricolage Wellness. And we'll also include that in the bio and the website. But yeah, she can't be our therapist because of conflict of interest, so she should be yours.
Because she's been giving us, she's been giving me free therapy since I was 14.
Yeah, truly,
we go way back. But if she seems like the right type of professional for you, maybe reach out.
I do specialize in perinatal, so like it's pregnancy, postpartum, but I also do work with others. Like I do work a lot with anxiety, depression, and everything in between. So it's not just limited to that. I also do offer a sliding scale. So if resources or finances are a concern, I don't want there to be a concern. So I'm here.
A true angel. I have a question kind of still regarding not gatekeeping, that's the wrong word. What's it called? Not gatekeeping. Just access. Like accessibility. Girl,
I got where you were going, but I was like, there is no better word.
No, I was like, what is it? Accessibility. That something that I've noticed like being talked a lot more on the internet is accessibility to diagnoses for people of color who like already in there, as like on top of like just getting in the door of like getting those extra resources of like, okay, well, do I need to see a psychiatrist as well, or do I need to see like a neurologist? Do I need to get any of like these testings done? And then like the accessibility of having that involved with insurance, and like, do I have to drive 2 hours away or whatever? Like, do they do phone calls? And like, are they going to refill my prescription on time? Or like, am I going to take this test and is someone actually going to diagnose me with something that like I genuinely do have all the symptoms for, but it's like not how a white person would be presenting, because there's obviously cultural like impact in that as well. So like other people, it just molds into a different thing. And that was something that I saw a lot this summer, where like quarantine happened and people were noticing that like, oh, I have a lot of these symptoms of like ADHD and autism because I've been like self-isolating and I haven't been like masking a lot. And so like now all of these things that like these habits that I've built for like to be socially acceptable or whatever are like going away because I'm not in society anymore. And so then they like tried to get diagnosed and stuff and see like, hey, is there any way that I can like function better and like be healthier or whatever, work on these, because they're like debilitating to me. And so many people were like, no doctors were like listening to me when I was telling them, hey, I've done my research, I've like read medical journals, like I've listened to like other people talk about these, they have the same symptoms, we just grew up in different like environments, and so it's like showing, it's presenting a little bit differently. But I think I have this, and like I would like assistance with it. Is there anything you could do for me? And people would be like the doctors would tell them like, no, I don't think you have that, like it's probably just like generalized anxiety or whatever, instead of like autism.
Like with no testing or anything, they would just flat out like no.
With like sometimes people would say like they never got me like it took forever to get them tested, they wouldn't let them get tested, or they did the testing and then it still came back as like, no, I still don't think you're right. And so it's like the believing people when they're telling their symptoms, and also like the way that your culture and like your upbringing affects how people like perceive your symptoms, and the accessibility to that of like, are you actually going to believe me? Like, am I ever actually going to get diagnosed with the thing that like I'm pretty sure that I have, that everyone else like acts the same way and presents the same way. Like I feel like a lot of people are really frustrated, and then they lose hope because they're like, well, if no one's gonna believe me, if no one's gonna like help me, well then why should I help myself? You know?
It's essentially an overarching gaslighting of
And that goes all around in every aspect of the medical field. With black and brown women, and black and brown people. It's a shame.
Have you noticed anything like in assistance to that, or like in classes that you took, like besides that multicultural class?
My concern when it comes to like multicultural aspects in counseling, there's two different things that can happen. A lot of the times we'll see like something that is cultural, like perhaps like maybe like for in Latinx communities, like a lot of times we will do like house chores, like a lot like at a young age or things like that, or we might present in certain like anxiety in a certain way or depression in a certain way, and that can be easily dismissed by a therapist that's not trained in that. Or the other way around, we might consider those things as like, oh my gosh, they are symptomatic, like they do have anxiety and depression, or like it might just be a norm for us. So those are the two aspects that can be sometimes concerning. It is incredibly frustrating when you go to people and like say, I need help, and I think that applies to everywhere, like mental health, physical health, everything. OBGYNs and COVID, people of color were dying way more than white people at highly disproportionate rates, which is just so saddening and heartbreaking in those areas. So I do see that, unfortunately, a lot, like across everything. But yeah, it's going back to the doctors and the therapists. Like I feel like that's where their responsibility really falls. Like I don't think like you have to advocate for yourself in that sense, like as a doctor or as a therapist or anything, it's your responsibility to be there for your patient or your client. So this goes back to them and their responsibility. As a client or as a person that's seeking help is, I know this sounds really cliche and so stupid and so nothing, but like not give up on yourself. Advocate for yourself.
Don't let up. If you know there's something wrong, there's something wrong.
You know yourself best. You know your body best. You know your mind best. You know yourself better than anybody. Even if you've seen a therapist for 20 years, you know yourself. So if something's up, just don't give up on yourself. Even if other people are giving up on you, they're the ones that are failing on that, not yourself. So that's as much as we can do, because people suck.
We love you. We have one last question.
It's a very important question.
We ask all of our guests this. Obviously, the name of our company is called Mila Tinidad. And now that we've been talking a little bit about how you're serving the Latinx community, what does Mila Tinidad mean to you?
Good question. It's been quite a journey with it, I feel. When I first moved to the States, and I'll keep this short and sweet, but when I first moved to the States, one of the biggest things that I noticed was how much I wanted to hide Mila Tinidad. Like I moved to Arizona, and like Arizona, there's a lot of white people there. People didn't know where Puerto Rico was. Like they're like, a Puerto Rican, what is that? And like it was just so many things. Like what is that? I don't get, like we know Mexicans, and like that was people. It was quite an experience. So a lot of the times I just wanted to be as white as possible. And like one of those things that happened was when I grew up, and I know you guys know this, like I had a lot of tan. Like I had a color in my skin. I don't anymore.
That's just from living in Chicago. Chicago has stripped away a lot of our color, but when we lived in Florida, baby, that caramel skin,
beautiful.
Shy City will like really beat you down into the ground. You're gonna be looking busted 90% of the time.
Yeah, we stripped down to our undertones, just glow green.
Obviously
it's olive.
Puerto Rican sun will really do something. But I had color in my skin, and then when I first moved to the States, it kind of started going away, and I got whiter and whiter as like the days came, and I was like, what is going on? But then with time, I was like, yes, like finally, like I'm kind of matching everybody around me. I started changing my eye color. Like I put blue contact lenses on, and I would straighten my hair even more than I used to. Like I just wanted to be like everybody around me. It kind of just became about like hiding where I was from and who I am and like my culture and my family, and more about like just blending in. It wasn't until, I don't even know what moment exactly, but probably when I was in college already. That's when I started learning. I was like, screw that. Like, why would I want to do that? I think we're fun, we're feisty, we have spice, we have color, we have all these things, this music, and all this stuff. And that's where I really started owning up, like, this is who I am. And there's not only is there nothing wrong with being who I am, I freaking love it.
There's pride in that.
There's pride in that. Like, Puerto Ricans, they're annoying as heck. Like, when it comes about being Puerto Rican,
I want to be shown off like a Puerto Rican
flag. Showing off.
When I met Jennifer, I remember one of the first things she said to me, I immediately said, "Oh my God, you have an accent. Where are you from?" And she immediately shut that down. She was like, "I don't have an accent," but with like the thickest accent type thing. And she was like, "Oh, I'm from Puerto Rico," and I'm like, so late, because like I'm Dominican. Oh my God, we're gonna be best friends. And she was like, "I don't have an accent though."
And like the thing is, you were like the first person. Like, I had been in the States like over a year by then.
Yeah, because she lived in Arizona for a year.
I lived in Arizona for a year
before she moved to Florida when we met.
Yeah, and then we met there because it was my second semester.
Yes.
Yeah, it was a weird year. Anyway, but you were the first person I met. I was like, oh my gosh, like Caribbean, like, oh my God, I'm not being freaked out, but like being Puerto Rican, like there's somebody I can talk to, and like all this stuff, and like this weird connection. I was like, I haven't had that in the year and a half that I've been in the States. So it was, thank you. I love you for that.
I love you.
The power of
Here we are.
Besties for the resties.
For real.
But yeah, no, I used to I would sit in front of the mirror, like practice my accent. Like, it still comes out here and there. It's probably come out here and there, but I own it now. I was like, yes, like that actually reminds me of like where I come from. Yes, it's like it's somehow like flipped from like what I used to hide is now what I want to show off even more. It's like, okay, this is like my accent comes out good because I'm Puerto Rican.
I'm Puerto Rican.
That's what it is. Like that's good. So yes, now I don't wear blue contact lenses anymore.
Gracias a Dios.
Gracias a Dios.
Yes.
Don't
get me wrong, we love a blue eye.
Yeah.
And there are Latinos with blue eyes.
My boyfriend is a Dominican with blue eyes.
There you go.
There you have it.
Yeah, and that's the thing too. Like people, like Latinx people, come of all shapes, sizes, colors. Like you go to Puerto Rico, and it's like people will be like, my mom, she's white with blonde hair and green eyes. It's like you would never think, like in America. It's but in Puerto Rico, you don't even question it. It's
like that woman's accent.
That not a lick of English. Not a lick of English.
We love her.
I love her to death.
Shout out to you, Janet.
Shout out to Janet. She's love of my life.
An icon.
That was such a beautiful answer. Thank you, Jen.
Thank you so much for being here, joining us.
Thank you. Thank you for having me.
Where can people find you?
Bricolage Wellness, or you can go on Psychology Today. I am also working on getting on all the Latinx therapy, all the fun stuff. So it'll all be on the bio. I'll be there. And
And Jennifer Miranda on Instagram?
Jennifer Miranda on Instagram. Yes.
She has the cutest dog.
That's literally what I was about to say.
Yes.
Her puppy Boone is often featured on the Instagram.
Yes.
Boone also has an Instagram.
Boone also has his own Instagram. So if you love mini Aussies, he's a panda-eyed mini Aussie with the sweetest soul, and he sings.
And he
sings. And he's a Beyonce stan.
He's a Beyonce stan.
We all
Who isn't?
As we all admit.
If he wasn't, like, disowned. Back to the shelter.
Okay, y'all. So if you learned anything from today's episode, believe in yourself. You know yourself better than anyone. Seek help if and when you need it. And it's all going to be okay. Keep working on yourself. You're going to be with yourself for the rest of your life. So
we love you.
We love you.
Yeah. And we're here to support you too. That's the whole point.
Absolutely. But yeah, thank you guys.
Thanks for joining us.
Yeah.
Gracias.
Thank you. Bye.